My name's Professor Tracy Smart, AO, Air Vice-Marshal, retired. My current role is Professor of Military and Aerospace Medicine here at ANU, and I also have a couple of other roles at ANU, and that is Director or Interim Director of the ANU Defence Institute, and as a Mission Specialist at the ANU Institute for Space. My background is that I was an Air Force doctor for 35 years, starting off as a GP on bases, and then over many years and many deployments and many leadership experiences, I ended up in my final role as Surgeon General of the Australian Defence Force, in which I was responsible for healthcare delivery for people from all three services of the Australian Defence Force, and also providing strategic advice to the senior officers such as the Chief of Defence Force and the service chiefs as well. Since I left in March 2020, which of course was just in time for a lockdown from the COVID pandemic, I've spent time doing a number of different roles in what I sort of regard as a portfolio career. My first major role was here at ANU, was running the COVID response for the university, which was a very challenging role, but also a very interesting role to be involved with, and was a really good transition role from the Defence Force. I'm still working at ANU, although I'm now more part-time, and over the last few years I've been involved in a lot of different parts of medicine. I've been involved in health security and public health, also involved in Aerospace Medicine, which is picking up from my earlier career in the Air Force, and now, of course, with the other roles that I've talked about earlier. But that's not all I do. I've also undertake a lot of other roles that are health-related. I'm on the board of Goodman Aged Care. I'm a director, but I'm also chair of their Care and Clinical Governance Committee, which, of course, is very important in the aged care environment of today. I'm also chair of the AFL Mental Health Steering Group. I worked for the AFL during COVID as their public health advisor as well, and I'm a lifelong AFL fan, Crows fan in fact, and I really enjoy the way the AFL has approached dealing with mental health issues in the industry, which have some similarity with some of the issues we have in defence as well. I've also been co-chair of the Veterans Advisory Group for the gallery development at the Australian War Memorial. Those galleries are now up and running, and so that role is coming to an end very soon. Apart from that, I'm also the chair of the Advisory Council for the Anzac Research Institute up at Concord Hospital. This is an institute that began its life following the transfer of the old Concord Repat Hospital to the New South Wales Government, and it was put in place to look at biomedical research for all of the community, but particularly veterans. I'm now overseeing a pivot back to doing more veterans and military health at the Anzac Research Institute. Two of my other roles are being a member of the Defence Honours and Awards Appeals Tribunal, and also a professorial fellow at the University of Melbourne, and in particular Phoenix, Australia, the Centre for Post-Traumatic Stress. Both of these roles involve sort of assisting veterans, particularly looking at mental health aspects. The Defence Honours and Awards Appeals Tribunal is really designed for people who feel they need, earned a medal, but they didn't receive it, or an honour. And a lot of times there are mental health issues concerned with that. And of course, Phoenix, Australia specifically looks at post-traumatic stress and other related conditions. And that's obviously an area that a lot of veterans suffer from. I also do a number of other roles, advisory roles, some contract work with commercial organisations on health-related issues, and also a lot of keynote speaking to share my experiences and hopefully inspire others to have a career in medicine or military medicine or aerospace medicine or any other things that I'm involved in. I began, of course, life doing medicine, doing my medical degree at Flinders University, and it was while I was at Flinders that I met a couple of people who joined the Air Force undergraduate scheme. And although I thought, gosh, I might be a GP, I might be a psychiatrist, I might be a paediatrician, I decided that it might be fun to join the Air Force it would be 3 years after I finished my medical degree. So I joined the Air Force in my 5th year of medicine, and I really looked at it as a bit of a break after all of those years. 18 years of study, an opportunity to do some fun things for a while, like aerospace medicine, aeromedical evacuation, that sort of stuff, to set me up for my medical career. It was in my final year of that period that I owed of service that I actually got offered the opportunity to go to the UK to do the Diploma of Aviation Medicine. And I think that was a real turning point in my career. If I had not been offered that, there's a good chance that I might have left the Air Force at that time and gone into one of those areas, those specialties that I mentioned. But going to the UK, first of all, doing the diploma course in aviation medicine and then actually teaching aviation medicine to aircrew, it really made me fall in love with that area of medicine. Not very well known, particularly at that time, but it really was an opportunity to, to not only practice clinical medicine, but also, understand in a bit more depth physiology and a whole heap of other constructs as well, including things like how do you deal with high gravity, how do you deal with microgravity, all of these things too. So that was a real turning point for me, I think. Now, I came back after that and I think I had about 18 months, 2 years of service that I had to do. And again, I thought, well, maybe it's time. Maybe I should look at a career outside of Air Force. Maybe I could look at an aviation or aerospace medicine career in the civilian sphere. But that's the real second turning point, I guess, of my career was when I was actually sort of selected to deploy to Rwanda on a peacekeeping mission in 1995. That mission is quite infamous, I guess, because it did cause a lot of damage to a lot of people I served with. A lot of people came back with post-traumatic stress disorder, and many of them are still suffering today. But for me, it was practicing medicine at the extremes. I had, back on a base as a GP, we used to joke and say we saw people with coughs, colds and sore holes, and that was about it, because most of our people were fit and healthy. But in Africa, we saw people who were malnourished, we saw tropical diseases, illnesses. We saw, of course, the effects of, war. We saw machete wounds. We saw people who'd lost limbs due to mine injuries, grenade injuries. And we also saw a lot of kids who we know would have had a chance to live really good lives in Australia, but were really sometimes had no future. That was really, really quite devastating. But at the same time, we were able to help a number of kids who wouldn't have been helped if we weren't there. So to me, in a way, that was the coalescence of all the reasons I joined the Air Force without knowing it. It was being over there in the middle of Africa, doing some good, making a difference to people's lives. And I really think that is when my clinical career reached its pinnacle. And I probably was never going to get anything like that again in my career. I always say that my service in Rwanda was really the reason I stuck around in the military for so long. And it was because of the experiences there, but also because I could see that there were some aspects of that deployment, because we hadn't deployed a lot prior to that since the Vietnam War, particularly in the health side of things. I saw there was a lot that maybe could be changed and could be done better. So I guess I then sort of got that motivation to stick around and to really sort of move away from clinical medicine into other areas of medicine. Part of that was going back and becoming the first female commanding officer of the Institute of Aviation Medicine, and I really enjoyed my time there. But that was also, as I said, as a commanding officer or CO, so it was a real leadership position. And I found that I was really suited to leadership. And through leadership in health, I could make a real difference. And I liked, people say to me, oh, you study medicine, but you don't do medicine anymore. And that's not true, because what I see it as is if I had become a GP, I would be helping people one by one, and that would be great. But by sort of coming up into these leadership positions, I was able to influence a whole health system. So I was able to influence the health, hopefully positively, of thousands and thousands, or tens of thousands of people. So it's still doing medicine, it's still doing health, but it's doing health at that more strategic and more public health level. And I think that's what's motivated me for the last many years. And when I got out of defence, that's what still motivates me, to be an influence, a positive influence, to make changes to the lives of many people through my medical knowledge and through my medical or health leadership abilities. I was inspired as a kid back in the 60s. Yes, I am very old. I was inspired by the Apollo missions. I still remember watching Neil Armstrong walk on the moon. I've still got my scrapbook that I put together as a 5-year-old of Apollo 11 and the moonwalk. And it was always, I guess, when I was a really little kid, if you asked me what I wanted to be, it was probably an astronaut. Now, in reality, that was very unlikely to happen, but I think it planted a seed so that when I joined the Air Force, Aerospace Medicine was really one of the, the driving forces as to why I chose that career. As I've mentioned, I was able to follow through and do a lot of aerospace medicine, as well as a lot of things, as the CEO of the Institute of Aviation Medicine. I was also able to go over to the US and as a flight surgeon in Air Combat Command Headquarters. That was an exciting time over there. I was over there during 9/11. I was on an Air Force base when that happened, so that was a very exciting and scary time. And then after that, we were able to plan the deployments of flight surgeons to the Middle East to support the aircrew who were going off to war. But after that, I kind of went into the career of leadership and management and became a more generalist, medical leader. So one of the real delights for me has been to go back to aerospace medicine through my involvement here at ANU as the Professor of Military and Aerospace Medicine. So I'm kind of back to where I was as a 5-year-old, contributing. A lot of my work, of course, being in Air Force has been in aviation, but increasingly nowadays we're looking to space, because space is, appears far closer, if you like, than it was back then. We no longer just have, NASA and the Roscosmos in the USSR sending up astronauts on very, exclusive missions. We now have many, many more people going to space through those organisations, but through space agencies from a lot of other nations. Australia, of course, has had its first astronaut who's been trained under the Australian flag, Catherine Bennell-Pegg. And we're seeing all these commercial space operators now contributing and perhaps even driving some of the space activity. So a really exciting time, and a really exciting time then to pivot to the space part of aerospace medicine. And that's what I've been hoping to do here at ANU. I think at the moment there's a lot of emerging research that's going on, and the most exciting part of it is, I think it's twofold. First of all, it's accessibility to space. We're going to see many ordinary people having the opportunity to go to space over the next few years through commercial operators. So it's not just going to be highly trained astronauts who are athletes in a way. It's going to be your average Joe, hopefully me one day. And we'll be sending people up with all sorts of medical conditions. And so there's a role for doctors in that area to make sure people are fit to fly and make sure we have all the countermeasures in place to ensure they stay healthy during their flight. So if you don't know what I mean, I'm talking like Katy Perry last year and colleagues who went on a 10-minute or so suborbital flight. We'll see more and more of those things happening, and I think that's exciting. So it's getting that fitness to fly industry, making sure doctors are upskilled to understand the risks of that sort of mission and ensure the people who are going on them will come back down in one piece, if you like, fit and healthy. So that's one trend. The other trend, of course, is that finally, the first time since really the Apollo missions, we'll be sending people back to the moon and beyond. Now, we've been to the moon before, of course, but we'll now be looking at, having a base on the moon. There might be workers on the moon or asteroids, etc. So that's the second part of it, is more and more people will be living in space as well. And we need to make sure we understand what the long-term effects of space flight are and living in that microgravity environment. We've had, some of the astronauts on the International Space Station have been in space for, a year or more, but do we understand what it's actually like to live in that environment? And that's, I think, where another area of research is really important. And the final one, I think that's the most important, is we're looking to go to Mars. Now, we know people like Elon Musk are really pushing for a Mars colony, but it takes a long time to go to Mars, and it takes an even longer time to come back, probably, depending on where the orbits of our two planets are at the time. So we're going to be sending people off from Earth who not only are they away for a long time, they're in space for a long time. They'll get to Mars. It's a different environment to the Earth, so they have to be able to learn to live there, having come off several months in microgravity. And then they'll have to come back again. During that time, they'll have very little connectivity with Earth. They'll have connectivity, but it won't be real-time connectivity with Earth. So they won't be able to ring up their spouses or their friends or anything else. It'll just be that crew working in an adverse environment for a prolonged period of time of maybe 18 months or more, potentially. So there are a lot of psychological and behavioural issues involved in that. And I think that's where perhaps some of the most interesting research is happening now. It will actually require not just doctors working on these issues, but a whole sort of swathe of allied health professionals as well. I mentioned mental health issues, behavioural health issues. So psychologists are already very much involved in this sphere. People like dietitians will be important because they need to ensure that astronauts have the right food, not just nutritious food to keep them alive, but also we get a lot of satisfaction from food. It's actually a component of mental health. So designing food that will last for that length of time, be nutritious and be palatable is quite a challenge. Physios are involved looking at posture in space. If we don't have gravity pulling down on us, 1G gravity, that makes us stand up straight and makes our, bodies function, then we have to look at how we can actually overcome that. Astronauts already on the space station, they have a treadmill they run on that they're actually sort of weighted down on so that they can actually keep their muscles functioning and their bones from not losing too much calcium. So this is already known, but for a longer period of time, physios might be designed in, how do we have people sleeping? How do we have people working? All of those things as well. I think the other area that I find quite fascinating is that we may see people who would regard on Earth as being disabled actually might have a role in space. They actually might have some advantages over, so-called able-bodied people in that environment. For instance, if you don't have use of your legs, or if you've had amputations or whatever, you actually may be much more easily able to get around in the zero gravity environment and be a much more functional crew member and maybe take up less space, which is a good thing. I think we'll see these people going into space as well, and this creates a whole heap of other allied health positions that might be important to ensure that we get the best out of people and the best out of our missions. The other area is even people who work on the fringes of health, like biomedical engineers and people designing spacesuits. All of those people are going to be important in keeping humans not only surviving in space, but also thriving in that environment. given everything that I've said about how important health and medicine will be in space, I think it's important to point out that Australia's lagging a bit behind in this area. As I said, we do have our first flagged astronaut, but she hasn't flown yet. And but we can't just leave this to countries like the US and everything. We need to build our capability here in Australia. And that's been one of the motivators for me in my post-Air Force career. How do we build this national capability? So, for instance, if you're a GP, do you know if someone's fit to fly in space? If they come to you and say, I'm flying on this suborbital mission next week, am I fit to go, doc? What are you going to say? What do you need to know? So I think this is an exciting industry, and especially those of you who are younger than me, I think you'll see this industry just exponentially grow. And you could have a place in it that could be very exciting. You could be a health professional on the moon. You could be a health professional flying to Mars, potentially. But you need to start now. We need to start now in uplifting this capability across the nation, so that Australia can take its place in this sphere. Now, some people might say, oh, space, it's all science fiction and everything else. But the truth of the matter is that solving the wicked problems in space from a health point of view is a great way to actually solve problems on Earth. Many health benefits have come from research in space. So think of it in both of those ways. You could be a space doctor, or you could know enough about it so you can apply some of those technologies and treatments back here on Earth.